Okay, so I'm
Yes.
happy to have on online today Dr. Risa Ravitz from New York that's been going through the Free Your Back Pain program. And Risa, tell us a little bit about yourself. What do you do in your everyday life? Let's just begin with that.
Sure. So thank you for having me. And I'm a doctor in New York City. I'm a neurologist. So I'm boarded in by the American Academy of Neurology, but also in pain management. So I have a private practice in New York City, and I see patients every day, primarily for neurologic problems, but I see a lot of patients for headache, back pain, neck pain, and the gamut of general neurology.
All right. And how many years have you been doing this practice?
Coming up on 9 years
9 years
since residency. Yes, since training.
since training. Wow, that's amazing. And more or less, how many patients have you treated?
150 plus patients a week.
Wow. Okay,
Yeah,
just do the math.
yes, a lot. Do the math. 100 a week, let's say.
So those are thousands or tens of thousands of people that you
Yes.
help. Okay. And so for the next question, Risa, what brought you uh, to know me, to the program, to free your back pain? What brought you to the alternative way of self-healing?
I grew up, luckily, as an athlete. I had a lot of wear and tear in my body, had a few back injuries that led me to explore sort of what was going on. And I would have pain that would usually go away in a day or two, but instead it would sort of hang around for a week or 2 weeks, which was kind of too long to deal with. So it definitely interfered with working out. Like, I enjoy being active. I could do everything, but I didn't like actually being in pain, and I was worried about it. So as a doctor, obviously, I sort of knew exactly what was going on, and then I would convince myself I needed other things done, and that made me sort of anxious, and like I had this feeling like the pain would never go away, which is an awful feeling. It's a really awful feeling to think like I'm not going to be able to do this thing that I love without having pain. I think that was actually more of an issue for me than the actual pain. Like, because I got used to, as an athlete, like experiencing pain, and but it was a lot of pain, and sort of so specifically like any kind of higher impact type exercise, so running, tennis, yoga, any types of hyperflexion movements, even twisting movements were really a problem. So I think I would avoid them. And it definitely affected me. I mean, the fact that I couldn't do exercise, like, it affects my mental state, it affects my weight, it affects everything. So I wasn't able to go all out, like in running or tennis, just doing sort of more intense physical type things. So I avoided it. Obviously, I went down the conventional path and had done imaging studies and physical therapy. And while some of those therapies worked, the pain kept on returning. And I found it very frustrating, and sort of talking to friends about it that also had similar problems. And I wanted to find a different solution, and heard about you through a friend, as we know. So figured, why not give it a try? There was a surfing trip I wanted to go on that was very intense, like surfing 4 hours a day, 2 to 3 times a day, basically. So, and a lot of hyperflexion and using your back. So I was sort of aimed at like getting to this trip and being able to do that, which I was able to. So the physical part of that was very helpful. The mental part of it was an unexpected sort of piece of things, but something that I am used to. I sort of like the idea of it and think that there's definitively something to it. I never really I don't know, never really sort of like targeted it in the way that you do. So I think that there's probably some real truth to, you know, why we become so rigid and get back pain literally. Um, and it's a very interesting way to kind of cope with it. Um,
What was the training like? Could you just tell a little bit about the physical training before we dive into the mental part?
yeah, so it was a series of exercises for 15 minutes in the morning and 15 minutes at night that was very interesting. It kind of seemed very simplistic in the beginning, but was just enough to kind of like push yourself at each level and break a sweat just a little bit, like right at the end. There's a lot of breathing exercises and working on core muscles that I learned about, I think, in a lot of other modalities, but never really focused on as much beforehand. And then after 6 weeks, I slowly integrated like more fast walking and some jogging and some more yoga, and then eventually went on the surf trip, which was actually very intense, and I was fine, which was awesome. I think what I initially found interesting was that the exercises and the way that you approach this, um, sort of the regularity of it was actually really good, because a lot of the modalities that we use in the States and in medicine are driven by like what insurance companies will pay for. And so that translates basically into, like, for physical therapy, for example, like at the most like 3 times a week. So you'd go for half an hour, and you'd kind of feel better, maybe if you're lucky, and then the pain would tend to return. So I really wanted to find something that was more regular to sort of rebuild. But things like yoga and strength training that I would do on my own were like too intense, and I just kept hurting myself more. So that's why I was sort of initially attracted to it and figured I had to do something about it. So that's kind of where everything came from.
Yeah, so 15 minutes morning and evening, you follow the routine, and within 6 weeks you got your body back. So that's
Yeah.
that's a huge win in a
Yeah.
short amount of time. And the second question is, well, being a neurologist, first of all, you came to this as a doctor that knows the medicine, the pharmaceutical solutions world, and you chose something different. Um, do you want to elaborate on that?
Sure. I mean, I I can tell you, I'm boarded in pain as well. So I've dealt with a lot of chronic type pain conditions and acute type pain conditions, and really gotten into the science behind pain, sort of the science. I think for me, personally, I, I did scans of my back to sort of see what was going on, and I can tell you I had the classic like herniated discs that would got worse a little bit over time, and then I thought I had other joint problems, and then did scans on those, and in fact didn't. I thought I had a labral tear in my hip that I was almost certain I had, and I didn't. So that was sort of interesting too, and that's something I see in my practice, where I think I know what the person has and it's not exactly right. um and I, for sure, I've used my fair share of like anti-inflammatory medicine and muscle creams, and definitely tried physical therapy. I'm kind of very hands off in terms of, I'm just personally not someone who wants surgery or even injections. There's things that are a little more invasive. I'm not sure. Like, I think they're great solutions for people, but for myself, it was something that the pain kept coming back, and I assumed it was going to come back even if I did these other interventions as well. So I knew I had to sort of like change something about me. I just sort of knew that inherently. And um, yeah, so I was glad to find you and be able to have something that I can use instead of these other things. It's been interesting to just remind myself that my body can heal and things can change and I can change my thinking and I can change all of those things. Because you need to know that like the pain is going to go away so you can reinforce that and know that it'll be all right. My friends all have a lot of back pain, the guys, and some of them are doctors and they know the same thing that I do. They end up not taking medicine. They end up not, there's no way any of them would get surgery unless they absolutely needed it. And they're probably not going to get some of these other modalities, and they're probably not going to do physical therapy. They're just like kind of guys, but they suffer like every day.
And do you want to elaborate on the thought process, or maybe an example or of something? You don't have to be too specific, but about the mental part, about the conscious part, about all the sessions that we did in terms of how we see reality and the reaction of the nervous system, the immune system in the body. So being a neurologist, you always get to work with the physical aspects of all the reactions in terms of the nerves in the body. But what did the thinking process that we did, the conscious part, how did that affect the pain, the reaction of the brain, the nervous system, whatever you want to elaborate on? Just go for it.
Sure. So I think that I'm a big believer that disease and pain is a manifestation of something much deeper, which sounds very new age and so forth, but I can assure you I am very much a scientist and very much, completely ingrained and taught in the dogma of science. So I still always like to go to sort of evidence-based things, and I also want to reiterate, like, there are certain bad things that sometimes you need to intervene, and that's a whole different story where things go past the point of what's sort of safe, just to say. But I have to say, like, most of the mundane kind of everyday common ailments that we have, especially with pain, are for sure rooted in something else, and I don't know exactly what that is, honestly. So all I can say is that I think your program like allows you to maybe just pause and look at that. I think those exercises were very helpful to sort of just get a framework of, okay, yes, I have these things that maybe are in my head a little more than I realize, and those thoughts have energy that affect me. If you believe that we're energy, and I do. And I think it was also helpful to sort of know that other people have those types of thoughts, and it's just a human condition that eventually gets like layered. You just sort of pattern, and the science, I should tell you as well, sort of supports like pain patterning. So the brain works in this way that it just habituates to almost anything. And as you get older, it gets worse. It's sort of, faster to be less open, and sort of faster to habituate to some sort of scenario. So what happens with pain, we think, and we know this in science, is that track gets like ingrained in the head and the spinal cord. Literally, those signals get ingrained a little bit stronger, and that stress response that you're talking about, the one where your heart rate goes up and you have an expectation of some feeling that's really bad, and everything, that sort of whole reaction really happens. So I think part of looking at the mental part of like what's going on is just allowing you to stop and kind of, just pause and maybe interrupt that cycle. I think I think the breathing part of what you added into these exercises is also really helpful, because when you start doing that, you actually like you trick your body. It actually activates like the parasympathetic response, the opposite. So that's what sort of that deeper breathing usually does, but you're doing it like in a forceful way, which is interesting, and you're definitely snuck it in there. So I think, really, really cool.
What do you have to say about the correlation between the breakdown of the thought process that we did in terms of mindset about perception about something that happened in our life, or let's say that suddenly there's pain that just came up, and towards the end or towards the last times that we were working together, I told you, okay, let's concentrate on recognition, on allowing ourselves to have these thoughts and not want to put them away immediately as a first instinct, as a first nature, but rather allow ourselves to hold or to have all of these positive and negative thoughts run through us, and like you were saying before, only accepting them as guests in our mind and not as constant habitants. Then what happens is that once we allow it to be temporary, or once we allow them to flow through us and not want to push them aside, then automatically what happens is the body does not go into defense mode, therefore affecting the nervous system. Do you want to talk about that a little bit, or about the thought process itself, that about accepting these negativities or positivities, it doesn't matter, run through us, and how it affects the nervous system and pain?
I've thought about it a little bit, and I think that as we go along categorizing things as good and bad, it has a very similar potential, like on the body, where your body's going to react, right? So in some way, and over time, that is going to cause some sort of response, and probably either some sort of repetitive, like pleasurable or painful response. And I think over time you end up just chasing it like constantly, both ends of it. So one of the things that I noticed about myself in this process was, for sure, it was interesting to see that like the negative stuff I was sort of seeing, my negative reaction, but I was also seeing like my expectation of a positive reaction, which was very interesting, honestly, because I started to like try to let go of that a little bit as well, which, that didn't lead directly to pain, or maybe it did, but it definitely changes like just your thinking. I guess it would change like the way I would approach things in general, which was really helpful. Yeah.
Do you think you have today, do you have mental recognitional tools to manage pain on your own by going through these sliced thought processes?
Yes, definitely.
Yeah, so that's a big thing, because the modern person, the everyday person that wants to have take a pill or drug the area, or not, to put the pain away, but not in a real way. It just shuts down the mechanism that says there's something wrong. But rather, you have a tool today on top of the physical tool, which works on its own, but you also have a mental tool. By acknowledging the thoughts that go through your mind, you actually reduce pain to zero.
Yeah. Yeah, definitely.
So that's, I mean, how do you see that? I mean, as a private person and as a neurologist, how do you like both hats within you?
I think as a private person, it's something that I've sort of known for a long time and just had to try. I needed a tool to be able to try it because a lot of these things are really, they're very disjointed. You go to the pain doctor when you have pain. You go to the headache doctor when you have a headache. You go to, the orthopedist when you have knee pain. You go to a therapist when you have anxiety. You go to somebody else if you feel down. It's very disjointed, and the truth is, like, there's probably a lot of interconnectedness. Not probably, there is for sure. So for me, as a private person, I think it's awesome because in the end, you need someone to sort of like hear you a little bit, but in the end, you really just need yourself to hear yourself. Um, that's really the best way, to not have to have anyone's sort of approval. It's about yourself in the end, which is also another layer. um Unfortunately or fortunately, the way that science is going, it doesn't look at things as openly, I think. And I think when you also go to like something that's, I don't know how to say it, like, and I've tried many of these modalities too that are sort of alternative but out there and don't integrate everything as well. I think you need to integrate some of the science. You need to integrate that because in this day and age, we still have a belief that certain things are necessary, right? So you could say you're going to heal yourself, but if you're like, God forbid, have an appendix that blows up, like, you probably need to see a surgeon.
Yeah.
So there's the things in your head that kind of, or you have, the heart, there's certain things that probably got to a point that's a different conversation, that are so bad that unfortunately our mind goes to that. I can't tell you how many patients I have that, they have a headache and they go to brain tumor. It's just, and the likelihood is just so, it's very minimal that that's really what's going on, but the pain just makes it jump. So, I think it's a combination of things that are going on. And medicine doesn't quite address all of that. It sort of feeds on anxiety a little bit more than it should, and doesn't integrate or consider these other factors or necessarily test them. They're starting to look at that, but they haven't really in an evidence-based way. And they also, the other thing to consider is, I know that an Advil is going to take my back pain away like quickly. I also know that it's probably going to come back like for the next 2 weeks. And I know what Advil potential side effects are. So I want a solution that gets to the root of the problem and eliminates it from happening again. You have to go through some pain to get there. And I think people are not necessarily willing to do that. They're used to a quicker fix, and it's hard to look at some of those things that you don't want to look at. It's always hard. Even after you do it, it's still hard, at least for me. And I think it's a practice that you have to keep doing. So again, I don't know if I answered your question, but hopefully
Yeah,
I
I
did.
mean, let's summarize. The last question would be, what would you tell, either as a private person or as a doctor, to someone that has back pain, or by the way, it's for, back pain, knee pain, upper back pain, lower back pain, um, any orthopedic pain? What would you tell him? How much would you recommend such a program in relation to other solutions out there?
So truthfully, I would recommend it wholeheartedly and with absolutely no qualms at all. The problem is getting people to a place where they're actually going to like do it. It's just, I think you have to get to a point yourself that you're so sick of feeling that way that you want, you have to pay the money and you have to do it. And I think that's all part of it.
Yeah, it's not made for everyone. I think also here in Israel, I noticed that it's less than 1% of people actually want to solve and take responsibility over.
That's probably close to the US as well.
Yeah. But then that focuses the treatment to people that are really devoted, and then the results are crazy. So
yeah.
And the main issue is the mindset. When you come to heal yourself, that you understand that the rest of the so-called solutions are not really solutions. They just make you feel as if the pain went away, but it's only drugging it or vaccines or whatever. All right, Risa. So thank you so much for your time, and have a good day. I'm gonna have a good night, and I'll talk soon.
Okay.
Okay, Risa. Bye.